This video is all about chest injuries. A traumatic injury to the chest area can be caused by a blunt force or a penetrating object. Examples of a blunt force injury might be a baseball bat to the ribs, hitting your sternum on the steering wheel in a car accident, or a rib fracture from a hard rugby tackle. Examples of penetrating trauma might be a stab wound from a knife in the chest, or someone falling onto a sharp metal railing or sharp wooden spike. A rib fracture alone is rarely life-threatening. They are very painful injuries because they move with every breath, which hurts. Due to muscles that surround our ribs, they are often stable fractures and will heal in place. If the blunt trauma is of a particularly high force, then it may cause a flail chest. This is a less common injury and is only seen in major trauma. The definition of a flail chest is when two or more ribs are broken in two or more places. It causes a section of ribs to come away like a raft, and that section will move in the opposite direction to the rest of the chest. This is called paradoxical breathing. The chest will not move up and down in one movement, but unequally. The person will be in a lot of pain, or unconscious, or will find it hard to breathe. The treatment for a flail chest is to call 999, monitor the patient and apply oxygen, and monitor oxygen levels if available. Position the patient in the most comfortable position, possibly inclined towards the injury. Make the call handler and the paramedic on arrival know that the patient has a flail chest so that they can treat and respond as quickly and appropriately as possible. If the person has a penetrating trauma, do not pull the object out. If the object has already been removed, look for any sucking chest wounds. Again, this is a less common but life-threatening injury. Inside your chest there is a small space in between the outside of your lungs and the inside of your chest wall. This space enables the expansion of your lungs by using negative pressure. So if this area is penetrated, then the air will be sucked in, leaving less and less space for your lungs with every breath. Their lungs will slowly collapse, and this is called a tension pneumothorax. There is a lot of biology to understand there, but all we have to remember is that if there is a hole in the chest area and the hole is sucking air in and out, then this is bad. The area will have a little blood around it, and the air moving in and out will make it look pink and frothy. If we have a chest seal in our equipment, which is often a piece of equipment found in a trauma or bleed kit, then we place that over the hole. It is a sticky pad with a one-way valve system and will let the air out but not in. This will solve the problem and the person's breathing will improve. If we do not have a chest seal, then we leave the hole open to the air, call 999 and make the paramedics aware. Look after the person as normal, monitoring their breathing and applying oxygen if it is available. To recap, a flail chest is a section of broken ribs caused by blunt trauma to the chest. We need to identify the injury and get emergency support. A sucking chest wound is caused by penetrating trauma. Apply a chest seal if available, and if not, get emergency support. They are both rare but life-threatening trauma injuries. Thank you for listening. I hope you found this helpful.